Dr. Chatterley, I would like you to shed some light on the fact of what happens when a person loses teeth. We talked about it that, other teeth start shifting, you can get headaches and all that. But what happens to the facial expression as more teeth as they're lost? I've heard that it's the root of the tooth which keeps the bone intact, and otherwise the bone shrinks, and that's where we get this caved-in feeling and look which we see in our grandparents where there was no implants around yet. Tell us a little bit about whether that's true and whether really, replacing the teeth, keeping them first, replacing them maybe with implants rather than with dentures, or even worse, doing nothing, really actually, shaves off 5, 10, 20 years of our life, which some people say. It does.
It's definitely the case. It's definitely true. The more that your bone and your teeth support the facial structures, you lose teeth, then the bone recedes when the roots are gone. The roots stimulate the bone to be there. When the roots are gone, the tooth's missing, then the bone recedes. Then the facial features sink into that area, and the more teeth that the particular buttress of the smile line are the 2 canine teeth, and if those are lost, then if they're not replaced shortly after they're lost, then the sunken look and the wrinkles that occur because of it, it's a pity that it's been allowed to happen, because it'll add several years or even more than a decade in appearance to a person in a very short while. So definitely retaining the teeth and the support by replacing makes a big difference in the appearance and the appearance of age.
Wow. So what we found out here is that a dentist can help with neck and muscle tension and headaches by replacing teeth, or by straightening out what you call the bite of a mouth, by avoiding gum disease and or taking it away. If a person does have it, he can help with kidney failures, liver, premature babies, heart attacks, strokes, fatigue, lowered immune system, and now you also become a cosmetic surgeon. You add on. You're really handy to have around you, dentists.
Yeah, handy to have around.
And yet you're one of the medical outlets we like to go to the least, almost. Isn't that amazing?
Yes, it is. It's like selling ice to the Eskimos, huh?
Yeah, it's like, here you're fixing so many things which most of us frankly never realize. It's kind of like getting old, and here we are spending money on whatever, from Botox to fillers to name it, and headaches, and it's not that every headache comes from a dental problem, I'm sure, but the point is many of them probably do. And then you have this gum disease thing, which apparently, 80% of all adults are having. So they're poisoning their body and wonder why they have to go to the doctor getting one more flu shot than they would like to, and one more of other types of medicines, wake up tired, name it. And a dentist, can help out with many of them and can eliminate that, and yet that's the last guy we want to see. Unbelievable. Dr. Chatterley, thanks for your being so informative again. Bye-bye.
Bye-bye.